Much for having me.
Well, in another development, the federal government has directed the evacuation of victims of Suleja tank explosion to tertiary medical centers in Abuja to ensure they get adequate medical care. The Minister of Information and National Orientation, Mohammed Idris, said this when he visited the scene of the tragic incident. We'd like to warn that you may find some images disturbing and viewers' discretion is advised. Our correspondent, Chenami Bami, reports.
The Saturday morning tanker explosion in Diko, Niger State, claimed over 80 lives and left about 55 persons severely wounded and currently receiving treatment at various medical centers in Suleja. The Minister of Information and National Orientation, Mohammed Idris, visited to commiserate with the people and also visit the wounded. He announced that the federal government has directed the immediate transfer of victims of the tanker explosion from Suleja General Hospital to tertiary health facilities to ensure they receive prompt and enhanced medical care.
So in the last couple of months, we have lost over 265 people so far. And this is not an acceptable situation, and that is why the President has directed that immediate steps be taken to give succor to those who are injured, to support their families, but to also do everything possible. Security agencies, the Ministry of Health, National Emergency Management Agency, all of them have been directed by Mr. President to ensure that these people that are here have been given this necessary support that they require. And for the National Orientation Agency under my ministry, to educate people, to engage in advocacy, so that people cannot just see tankers come down or involved in accident and then they go near and try to scoop.
He revealed that the President has constituted a committee to investigate these incessant accidents and recommend effective solutions to prevent future occurrences.
Ensuring that we give a human face to the activities that took place, and also ensuring that all the possible support we give the family and the family of those departed, the souls departed, and the families that are in the hospital. Will do our best to ensure that we provide support for them in, based on what the President has directed us to do. And everything that we're supposed to do, we will still be back here within the week to ensure that we activate all our machineries to provide the needed support for those people that are affected, the families that are affected.
The Niger State government also set up an interdisciplinary committee to enforce the directive of the governor on the usage of the Diko Bridge by truck drivers. Chenami Bami, TVC News, Suleja.
Well, let's quickly bring in our guests to give more perspective on this issue, as being joined by the Special Advisor on Special Duties to Governor Umaru Bago, Dr. Murtala Bagana. He joins me via Zoom from Minna. Good to have you on the news at this time. So yes, now understand that this is a recurring nature of tanker explosions in the country in recent months. Now, what steps now is the Niger State government taking now to improve safety infrastructure and ensure that residents comply to improved safety measures?
Thank you very much. I think the incident that happened at Diko in Gurara local government is a very devastating one. However, highly preventable. Immediately the incident happened, His Excellency Mohammed Umaru Bago directed the medical team to be immediately deployed to the site of the incident, and we earlier today visited two sites where patients who were evacuated from the site of the accident are being treated. At the time of visiting this location, 43 patients were admitted at General Hospital Suleja. Out of these 43, 8 of these patients died and 3 were treated and successfully discharged. Currently, we have 23 patients that are on admission and are receiving various forms of treatment. What the government of Niger State has tried to do is not only to deploy a multidisciplinary team made up of doctors, nurses, and pharmacists, but also His Excellency has provided supplies, commodities, and also cash donation to these patients. You will recall that DICO is a transit route, people coming from different parts of the country. So some of these patients will require some form of cash to feed themselves, but entirely the medical treatment is free. The supplies that we are provided are provided for free. And what we are advising is as much as possible for some of those patients who are in critical situation to be evacuated.
Point taken there, but I actually wanted to get your perspective on what the state government is ensuring that safety measures is applied, because this is a recurring incident we see in most of our highways. Now, in Niger State, the number of deaths recorded is about 80, and people were literally scooping fuel from a fallen tanker. Talk to us on what the government is doing to ensure that residents adhere to safety measures and, of course, reduce the incidence of tankers plying major highways.
Thank you very much. Immediately, His Excellency visited the site yesterday. He directed and ensured that there is a total ban on tanker drivers actually going through the overhead bridge. You will recall that there is a bridge at the DICO junction. So what usually happens is that these tankers try to embark on a shortcut. So what His Excellency has done is working together with the Federal Road Safety Corps and also the National Union of Road Transport Workers to ban tankers from going through that road. Another measure is the construction of the road. I think we don't want to overlabor this. This is the time for us to fix once and for all the Minna-Suleja Road. I think this is something that His Excellency has called upon the federal government to ensure that this road is fixed. But very importantly, we need to sensitize the public. There is this whole attitude of flee and flight. I think whenever we have this kind of incidents, people rush to the site of tanker to scoop fuel, and we need to sensitize. We need to work together, the traditional institution, the National Orientation Agency, to sensitize people on the danger of fuel and what it can lead to.
The hazards as well. Thank you so much, Dr. Murtala Bagana, Special Advisor on Special Duties to the Governor of Niger State. We appreciate your insights on the news at 10.
Thank you very much, and we commiserate with you.
You're still on to TVC News at 10. I still have to other news now, where the Senior Staff Association of Nigeria Polytechnic